The first step I do is to clean my hands using WHO guidelines. Palm to palm. Palm over dorsum. Fingers interlaced. Fingers interlocked. Rotation of the thumbs. Fingertips. Your wrist. And leave for 30 seconds to dry. If I am using soap and water, I will make sure to dry my hands with a paper towel. I will now introduce myself to Eileen. Assess safety. Approach the patient and ensure that privacy and dignity are upheld. Eileen, good afternoon. My name is Tendai and I am the nurse looking after you today. How would you like me to address you?
Good afternoon, nurse. You can call me Eileen.
Eileen. Can I confirm with you your full name and your date of birth?
My name is Eileen Jones. Date of birth is 28th of April, 1960.
Can I cross-check it with your ID band?
Yes, sure.
Okay. I can confirm that your name is Eileen Jones, date of birth the 28th of April, 1960, and NHS number is 123456789. Eileen, I can see that you have allergies too. What are you allergic to?
I am allergic to penicillin.
Can I check and confirm allergies with your red allergy band?
Yes.
Eileen, I will now explain you the purpose of my visit today. I am here to conduct a full assessment of you to inform our care plan. It will include taking blood pressure. Is it okay for me to proceed?
Yes, of course.
Thank you. I will go now and bring the equipment. In the meantime, if you need anything, please press your call bell. I will wash my hands following the WHO guidelines and will also bring the necessary equipment while ensuring to wear PPE gloves. Okay, Eileen, I am back now. Is it okay for me to proceed?
Yes.
To begin, I will assess Eileen's airway by inspecting her mouth. I'll ensure there are no obstructions since she has been communicating with me. Eileen, could you please open your mouth? Upon examination, there are no visible obstructions and I don't hear any snoring, indicating an unobstructed airway. Moving on to breathing. Eileen, if it's all right, could you cough for me? Excellent. I observe that Eileen is not using accessory muscles to breathe. And there are no signs of stridor or wheezing. Additionally, her breathing pattern and chest movement are symmetrical, without any seesaw breathing. Eileen, may I check your oxygen saturation?
Yes.
Which finger would you prefer?
You can use the index finger.
Perfect. Ensuring no nail abnormalities or trauma. I confirm that Eileen's oxygen saturation is 98%, which is within the normal range. Now, I will assess Eileen's respiration rate, comparing it to her heart rate over 2 minutes. Thank you, Eileen. I can confirm her heart rate is 68%. And her respiration rate is 16, indicating everything is in order. My next assessment involves checking Eileen's pallor and perfusion. To do this, I'll hold Eileen's hands and verify that they feel warm and dry without any discoloration, coldness, or clamminess. Additionally, her nucleus membranes aren't discolored. Moving on, I'll assess Eileen's capillary refill by pressing down on her fingernail for 5 seconds and observing how quickly the color returns. Eileen's capillary refill time is 2 seconds, indicating normal circulation. Now, I'll proceed to measure Eileen's blood pressure. Before doing so, I'll ensure the cuff is the correct size, covering at least 80% of her upper arm circumference, and confirm its calibration. Prior to applying the cuff, Eileen, I need to check if there are any lines in your cannula.
No.
Great. Any recent surgeries on this arm or issues with lymphedema?
No.
Perfect. I'll position the blood pressure cuff approximately 2 to 3 centimeters above the antecubital fossa, aligning it with the brachial artery inside your elbow. Before initiating the machine, I must mention that you may feel some discomfort as it tightens. If it becomes unbearable, please let me know.
Alright, I will.
Now let's start the machine. Thank you, Eileen. I can confirm that your blood pressure is 120/60, which is within the normal range. The next step is to assess for disability, utilizing the ACVPU method. Eileen, do you know what day it is today?
Today's Thursday.
And what month is it?
It's November.
Perfect. I can affirm that Eileen is alert and not confused. Eileen, have you had your blood glucose levels checked today?
It was 4.6.
All right, thank you. May I know if you've been passing urine?
Yes.
And do you have any rashes?
No, I've got no rashes.
Moving on to exposure now. Any abdominal bleeding or hemorrhage bleeding?
No.
I can confirm there is no abdominal distension either. Now, I'll check Eileen's legs for pallor and perfusion. I can confirm that her legs are pink, warm and dry with no signs of cyanosis, discoloration or clamminess. Additionally, there is no edema or deformities in her legs. Eileen, is it okay if I check your temperature?
Yes.
All right. Under exposure, I'll use the tympanic thermometer to check Eileen's temperature. Before checking, I'll ensure there are no signs of infection in her ear. Here we are. Thank you, Eileen. I can confirm that Eileen's temperature is 37.3, which falls within the normal range. Thank you.